welcome to another episode of the 2 Minute Warning, brought to you by the West Side Gazette. I am your host, Perry Busby. I want to welcome my co host, Mr. Bobby Henry, the editor and publisher of the West Side Gazette newspaper here in Fort Lauderdale, Florida. How you doing, Bobby?
I am terrific and getting better, and you just keep giving me many hats to wear.
You're a
What's
man
going
of
on?
many hats.
I know, man. One head, parody gets tough, baby. Mm-hmm. How you doing,
Tell me
man?
about it.
Hey.
Man, I am
Mm.
doing blessed and just happy to be here. Glad to have another episode uh, of the 2 Minute Warning. It's been a crazy couple of weeks, man, but we finally got to the end of one
Mm-hmm.
with this election. So, although the election's not over by some people
No,
say.
not by a long shot. If you listen to some people. Mm-hmm. Mm-hmm.
Yeah, it has been amazing. Uh, I've had some people to reach out and ask, what did I think, including some Republicans
Mm-hmm.
who've asked, and it's amazing. You hear Republicans kind of saying what Democrats were saying 4 years ago in terms of the election. And so it's just kind of funny. I mean, all that we've been talking about with this election now, security and everything else that we were talking about is now at the forefront.
Yeah.
You know, and so the black press played a part of that. I think our audience understood a lot of what was going on and hadn't been caught in by all this hoopla.
Mm-hmm. When we realize we really have skin in the game, it draws us a little closer to the fire, if you will. And then
Right, right.
when we begin to understand the rules of play, or the misrule in playing, we begin to watch and look a little deeper, and
Yeah,
we find out a little more. So
yeah. Yeah, and we're finding out that even as we dig deeper, some we find that the more things change, the more they stay the same.
hmm
Because now you see the Trump administration going after primarily African American, uh, uh, should I say, uh, counties that are predominantly African American.
hmm
And so they're doing that in Michigan, they're doing it in Wisconsin, and they're making those implications in Pennsylvania.
hmm
Uh, Somehow that uh, the African American vote is tainted.
you know, well, Perry, I still maintain that there ain't nothing new. Any way that our vote, our voice, or our self being could be diminished, they
Hmm.
they, they will try to find a way. But
Right.
thank God for the people like Stacey Abrams and those who are on the ground fighting and giving us a roadmap, if you will, to follow. And we
Right.
have enough sense to do that. So you know.
Yeah. Yeah. I mean, because they are picking through these results. I mean, you hear it in all the mainstream media how what's going on with Democrats, whatever. I mean, but we have to ask, well, what's going on with the African American vote? Uh, I know the West Side Gazette ran an article about the 12% of African American men who voted for Trump and how did we get there?
One of the disturbing reasons that I heard engage with the brother. He was telling me, he said that his nephew, who was uh, who did some time in the Florida state penal system, and he said to him, "Well, Unc, I'm voting for Donald Trump because he keep it real." So this macho image, or perceived macho image, seemed to have tainted the mind of some of our younger brothers, if you will, those who were
Yeah.
incarcerated. Not all of them. I am not
No,
saying
no.
that now. Mhm.
Right, right.
But
Yeah,
just
no,
to
but
think.
it does beg to ask how do we reach those of us who are not hearing the message correctly, or who are perceiving an incorrect message, and they are under some illusion. So is it that we aren't speaking to them, or is it just that what we're saying doesn't appeal, or have we ignored them? I think those are questions
Mhm.
we have to start asking.
Yeah, that too, coupled with the fact that there's some psychological damage done there, to think that
Hmm.
this bravado is some walk or some gauntlet to manhood. And
Yeah,
hey, you know, we
yeah.
still got work to do.
Right. Yeah. I mean, because as we say that, I know you and I could definitely say that that characteristic is not foreign. We have seen that, you
Mm-hmm.
know, in some ways, even if we thought it was, even though we may have dismissed it and thought it was in a minority, we find out that that idea,
Mm-hmm. Mm-hmm.
is definitely taking root in our community. I mean, and we need to address it.
Oh yeah, yeah. This new cycle, this new position. I don't know about you, Perry, but have you been watching TV lately in the commercials, and how you begin to see all of these black people appearing in commercials? And I was laughing. I was saying to myself, "Oh my goodness, damn! It's just like we just came on the scene. What's happening? We've been here. Now all of a sudden, every other commercial. I'm glad to see it. Don't get me wrong.
Yeah, yeah, yeah. I likened it to that scene in The Grinch when all the Whoville people came out
Hmm.
and sang around the Christmas tree after
Yeah.
being, and so uh, there has been uh, some sense of accomplishment,
Yeah.
and well, so I don't think we should diminish those who really put in the effort
No. You're right.
to get
Mhm.
those out. And so, and there's more work to do, and especially getting involved in the two Senate races in Georgia. I think that that's something that we all need to find a way to contribute to in some way,
Okay.
uh,
Okay.
financially. But man, we're gonna move on from politics, man.
Hmm.
The big thing that is still facing us all this year, and I know it has been a weight on me, and that is coronavirus. Coronavirus has been front and center in my life in so many ways, uh, and you know this show. Thank you for helping me understand that this show is so aptly named the 2 minute warning, because we have a lot of 2 minute warnings in our community, and this coronavirus is no different.
Hmm. And you're right, Perry. This coronavirus, this pandemic, we look at it from a distance, but when it finds itself at your doorstep, it creates a whole new window for you to look into.
Right,
And we have been touched by it also, very closely. So it does lends itself to us taking a look at it from a two
right,
minute warning perspective, up until the whole entire game plan. And
right,
and we're fortunate tonight to have with us as a guest Miss Marsha Mullins. Now, I know Marsha from a uh, the perspective of being a servant, understanding that she has tremendous accomplishments and a pedigree of uh, 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 knowledge. It's her willingness to share, to jump right in and get involved, that had caught my attention. She is that word in epidemiologist, and which is the education or the understanding of diseases, but it's much more. to her than that. She really delves into it, and she makes it plain so we can understand it. Now,
Right.
and she can, she can tell you about her resume if that's what you want to hear, but she can also educate you on the whole scope of diseases from where she comes from. So, Miss Mullins, you back there?
Right, I've been listening. Yes, right here. Hello, everyone.
Hey.
Hello, Miss Mullins. So
I'm
glad
so
of you to
sorry that there
join
was a little
us.
bit of a glitch earlier, but I'm here now. So, and thank you for that really beautiful and warm introduction, Mr. Henry.
Yes,
it's
ma'am.
good to see you. And Mr. Perry,
Thank you.
I hope to meet you in person when the time is right and when we're in safer times.
Mm-hmm. Mm-hmm.
Yes, as well, as
Mm-hmm.
well. So
Thank you.
glad of you to join us.
My pleasure.
Uh, there is so much information out here about coronavirus. I know to some degree, some people would say, if you don't know anything, it's just because you haven't been looking. Um, but I know a lot of people have been hearing things, and so let's kind of. What are some of the myths, first of all, that we need to dispel? Because I don't want to start with telling people what the good news is. Let's kind of get them away from the bad news first, so that they can understand it.
Well,
What are some of the myths really affecting our community that we're in this position?
I think, well, in the beginning of the pandemic, around, I'd say, early March, April, one of the prevailing myths was that people in our community, black people specifically, were somehow immune to it. And that came about because it seemed from the global statistics that the continent of Africa didn't seem to have very many cases. So it was assumed that people of African descent, from wherever they are, were somehow immune to the coronavirus. Obviously, that's not true. Now, we do see still that there are fewer cases per capita in the continent of Africa, Southern Africa specifically. Now, a lot of that could be because there is just less reporting, or there are far fewer resources for very good reporting and consistent reporting. But that was one of the prevailing myths. It's not true that black people are not affected by this. Quite the contrary. We are, and we are more so than our counterparts in other racial groups and ethnic groups because of many of the social demographic characteristics. For example, underlying conditions that we may have and jobs that we may have. So we are not immune to this genetically, physiologically at all. Not
Yeah,
at all.
yeah.
Um,
Now, when
that
you say underlying conditions,
yes.
what are the top underlying conditions? So we can.
The top
Uh,
underlying conditions for people of African descent, Latino as well, diabetes, hypertension,
Mm-hmm.
obesity. These are the top renal diseases as well, but the top three would be diabetes, obesity, and hypertension. Those are
hmm,
they. And regardless of your age, those conditions confer a more severe illness if you become infected. Now, it's not a given that if you become infected with coronavirus that you will have a severe illness simply because you have an underlying condition. That's not necessarily the case. However, your
hmm,
risk is higher because of having those
hmm,
conditions. And if you have more than one of those conditions, it's even higher. So you are at risk for more severe disease if you have at least one of those conditions, and certainly a lot more. Your risk is higher if you have more than one. So if you have diabetes, you're hypertensive, and you're obese, your risk of having a severe outcome from an infection is higher. Again, it's not necessary, it's not inevitable that you will have a severe illness. You could have all of those conditions and become infected and be perfectly fine. You have a little bit of illness
hmm,
here and you're okay. However, it's a risk profile. The probability is higher simply because you have these underlying conditions.
Mm-hmm.
hmm.
As far as other, to your earlier question, as far as other myths out there, I mean, there are very many. Unfortunately, some of them are probably not appropriate for this type of conversation. However, one of the big one is that if you are younger and stronger, that is to say, if you're younger and you feel as if you're more invincible, then you're not going to get a severe illness, or you won't get it at all. That is not true. Everyone, regardless of age, can become affected by the coronavirus. The younger people tend to have a less severe illness simply because their immune system is probably stronger, and they have fewer underlying conditions, and they have the underlying conditions at a time in their lives when they have the wherewithal, physiologically speaking, to manage those conditions better. So you might be hypertensive at 22. However, your hypertension at 22 is a far different disease than hypertension at, let's say, 42 or 52.
Mm-hmm.
Hmm.
So youth is an advantage as far as severe illness. However, it does not prevent you from becoming infected, and it certainly doesn't prevent you from developing a severe illness. However, your risk profile is lower for severe illness if you are younger. Males, there is another prevailing idea, myth, that males are less susceptible. That is absolutely untrue, regardless of age. And we're seeing quite the contrary, that males, particularly males of in the middle ages, 45 to 65, depending on um, which definition you go by. Some definitions start at 50, some at 55. I'm going to go with the
Hmm.
younger one, 45 to uh, males in that group tend to be a lot more affected. That is to say, they're more likely to develop severe illness.
Yeah.
Again, it doesn't
Yeah.
mean that inevitably they will, but they are more likely based on underlying conditions as well.
Yeah.
Mm-hmm.
Yeah.
Yeah,
If I can
no.
jump in
Mm-hmm.
Yeah.
right quick and just ask our audience if you have a question, please type them in through our Facebook if you're watching through the watch party, and we'll definitely relay it. Or if you're watching through YouTube, just type it into the comments. Uh, but this is just not a two-way conversation. We have a renowned
Mm-hmm.
epidemiologists with us. And so if you have
Thank you.
questions,
Mm-hmm.
we want you to ask them.
Mm-hmm. Let me ask you a question, Miss Mullins. The difference between an airborne virus and a different one, how does that affect its process, if you will? Uh,
Can you repeat the question? The difference between an airborne virus and?
yeah. Okay. Now, if we understand correctly, the coronavirus is an airborne virus. Is that correct?
Yes,
Okay.
it's in the sense that the droplets. So the coronavirus is transmitted in respiratory droplets. So when you breathe, when you speak, sneeze, cough, you emit droplets. Most of the time, it's microscopic. You can't feel it. You can't see it. As I'm speaking now, I'm emitting a lot of droplets. I cannot feel it. However, it is there. And so this is how the coronavirus is primarily transmitted, through respiratory droplets. So when we speak, for example, if we sneeze, cough, sing, shout, that's how it's transmitted. And if your droplet gets into someone else's mouth, for example, eyes, then there's a risk. If they have coronavirus, there's a risk that they may become infected. As far as it being airborne, it simply means that those droplets are what they call aerosolized. So the droplets are small enough to last, or to float in the air for a specific amount of time. Typically, we say 2 to 3 hours. So the droplets that we emit are so small that they become aerosolized. They can float in the air and remain in the air for about 3 hours, which is why we're calling it airborne. So that's why it's called airborne. Now, they don't, from the studies that have been done, they cannot really be carried by wind for a very far distance, for example, which is why the 6 feet apart social distancing came in. They
Mm-hmm.
cannot be carried beyond 6 feet before they fall to the ground. Now that's there maybe they can go further, maybe they cannot go as far as 6 feet, but that's the where scientists have decided the cutoff point is. So that's what it means that it's airborne. Anything that you emit in speaking, breathing, for example, becomes aerosolized, which is why places such as bars or any closed environment where there are a lot of people together talking loudly or just talking in a specific area which is poorly ventilated is such a high risk area, because essentially what's happening is you are creating essentially a cloud of virus that everyone around is breathing in.
Mm-hmm. So when it comes to family members, should family members around each other? That's a question that came up. Should they wear masks as well?
And you know what? The CDC has been dealing with this. If a family member is infected, the best thing for that person to do is to isolate. There there have been discussions about recommending that people even within a household wear masks. I think that one, yes, I agree that it is a recommendation that is based on the science of how the virus is transmitted. It is going to be very difficult, even under the best of circumstances, to get people to wear a mask indoors. However, it is a good idea to do that if
Mm-hmm.
Yeah.
everyone is willing to do that. Yes, it's not a bad idea. If you do not know the status of your family member, and your family member or as any member of your family or your friendship group is in and out and is at risk of having an infection, we all are. If we go outside our doors, we are at risk. Um, Wearing a mask is not a bad thing to do, and I would recommend that people do it. I do understand that it's very difficult to do so in your own household.
Mm-hmm.
Yeah. I have a question from Nelson Armstrong in Texas. He says, can a person who has recovered from COVID-19 get it again to the sense that they can transmit it to others, even if they don't get sick again themselves? Or they don't show the symptoms, I guess.
There have been studies that are looking at obviously the transmissibility of coronavirus from a second infection, and it is still quite rare. I think in the United States there are now maybe 6 cases where they have gotten a reinfection. As far as how well they can transmit it again, we do not know that yet. Obviously, if they have a second infection, then they have the virus in their bodies still, and they may be able to transmit it. But as far as I know, we don't know yet how efficient the transmission is for a reinfection.
Mm-hmm.
Now, if someone is asymptomatic, regardless if it's a first infection or a reinfection, they can at that point transmit it. They can. But how efficient or how virulent they are on the second infection, as of yet, we don't know.
Mhm. Okay. What about the it's Thanksgiving coming up, and everybody is concerned about traveling. There's some reports that say we shouldn't travel. We should just shelter in place and take it from there. What's your thoughts on that?
The CDC today, their guideline and their the latest guideline from the CDC is the recommendation is for people not to travel at all for Thanksgiving. So that's the latest CDC recommendation. It's actually a warning, not simply a
Mm-hmm.
recommendation, a warning saying do not travel for Thanksgiving. My feeling, personally, I would not do it. I would
Mm-hmm.
not choose to travel at this time. I would not choose to engage in a large dinner or however you celebrate it. I would not choose to do so. I
Mm-hmm.
would not choose to do so because I would not want to put others at risk. Now, I'm under the impression that I do not have coronavirus. I feel well. I'm not ill, but I have not been tested. I have not had reason to test. I have not been tested, so I do not know. I cannot say that I do not have coronavirus. I can only say that I think I do not. But that's not enough for me to say, okay, I'm fine going around other people. I am possibly a carrier, and any one of us may be, and I operate under the assumption that every single person is possibly a carrier. As far as Thanksgiving, that's how I look at it. I would not myself want to transmit it to anyone else, so I would avoid being in a large gathering at Thanksgiving.
Mhm. Miss Mullins, speaking of tests, um, um, is the, what is considered to be the best test to take, if you will? Is it to have something poked up your nose or swab your throat? What is the better of the test to really give us an indication to what is transpiring in our bodies?
Any test, right? Any test that actually is what they call a polymerase chain reaction test. And the ones that are going further up the nose, now the going up the nose, the reason why they do that is that's where the virus is most likely to be more what they call there's a lot more of it there. In
Mm-hmm.
the further up you go in your nostril, you can get it from the sides of your cheek as well. But the further you go up the nostrils, the more likely that you are to catch a nice culture of the virus. The
Mm-hmm.
PCR, the polymerase chain reaction test, is the one that actually tests for the viral particles in the in the swab. So that test is actually looking for the virus itself. There are others that look for antibodies to the virus. Those are not as sensitive because there are other coronaviruses that are around. The cold, for example, and other coronaviruses may be out there. And they may test another type of coronavirus, which is not the novel coronavirus that we're dealing with, which is SARS-CoV-2,
Mm-hmm.
which is severe acute respiratory syndrome coronavirus 2, the second coronavirus. The first one was in, I believe it was 2013.
Mm-hmm.
This one is a lot more obviously virulent and a lot more easily transmissible. But the best tests are the ones that look for the actual viral particles.
Mm-hmm.
Yeah.
And the ones that are
Yeah.
further, I'm sorry, the ones that are further up your nostril is the one that gets the best culture. It's a little bit more
Yeah.
uncomfortable, apparently, than a cheek swab, but
Mm-hmm.
it's more sensitive, meaning they're going to find more cultures, more viral cultures, and therefore a more sensitive test.
Yeah.
Okay.
Yeah. I
Okay.
have a question from a Glenda McCrae who asks, besides loss of taste, uncontrollable cough, change of lip color, what are some of the other obvious signs that people can expect to look for?
The new, what they call the new loss of smell and taste, meaning that you've suddenly developed this anosmia, which is, that's the name of sudden loss of smell, is one of the telling signs of coronavirus. There are others like a dry cough. A dry cough is one. Obviously, fever, but lots of things can cause a fever. Flu, for example. Other colds can cause a fever, but fever, the body aches, the chills, which are also common to the cold or the flu. But the loss of smell and taste, new, is one of the telling signs. There's also the COVID toe, meaning your toes become blue. Now it depends on your natural skin color. If you're very dark skin, you might not notice that your toes have turned a little bit blue, for example, and the fingers have turned a little bit blue. And that's probably because there's a lack of oxygen that's going to your extremities. That's why they turn blue. But if your skin is dark, like mine, you might not notice it as quickly.
Hmm.
But the
Yeah.
typical loss of smell, loss of taste, a very dry cough. A dry cough is one of the telling signs, a high fever. Now, if anyone has developed shortness of breath, they should really go seek medical help quite quickly. Do not stay home if you're having shortness of breath, and if you're having chest pains, for example, which is somewhat sometimes part of the spectrum of symptoms that comes with coronavirus. Do not wait if your face is turning blue, regardless if your lips are blue, regardless of your skin color, you are dealing with oxygen depletion and low oxygen. Go to the hospital or go seek medical help right away. Do not. It's not going to clear itself up. Go out immediately for those symptoms. Those are very severe symptoms, and they're
Mm-hmm.
life threatening.
Right. Right. Now, you you mentioned before about the 6 feet distancing and this being airborne. Now with it being colder, although that's not really a big issue down here in South Florida, uh, but in colder climates where there's more wind now, now with it being airborne, does that extend and does the cold air now let those molecules now maybe last a little longer than maybe the heat would? How does that play in the winter? I mean, because we're definitely seeing it now in some of the colder climates.
The coronavirus, according to studies and what tests they've done,
Yes.
seem to do better in colder, less humid conditions. Now, um, recently it felt like we here in South Florida, it feels a lot less humid. It's really very pleasant, which means the humidity isn't
Yeah.
quite as high.
Mm-hmm.
However, we still have very warm temperatures despite the lower humidity. Cold weather, um, the coronavirus seems to travel and survive better in colder weather. Now, the thing about the colder weather is more so the behaviors that are associated with cold weather, meaning people are going to spend a lot more time inside, and they're going to be in smaller surrounding, smaller areas inside because of the cold weather. So there is some physiological effect on the coronavirus itself because of colder weather and more and less humid temperatures, humid weather. However, it's actually the behavioral aspect of what people do in cold weather that makes it a more difficult situation. Really, it's about people moving inside, spending a lot less time outside, and being inside in very closed surroundings with poor ventilation. In typically in some places multi-generational households where you have grandchildren, grandparents, parents, second relatives, for example, living in the same household, and the risk of transmission between the groups is higher.
Mm-hmm. Yeah,
Hmm.
Miss Mullins. Okay. Now, not to scare or try to frighten anybody, but what are the latest numbers in terms of death? And if it continues this way, what are we looking at by the end of this year?
In terms of death, I think what I saw recently, we are now at, according to Johns Hopkins University, we've just crossed the 252,000 barrier. So there are 252,000 souls who have passed. Um, about 2 hours ago is when I looked at that statistic. We are
Mm-hmm.
at 11.5 million infections in the United States of America, and we're at about 80,000 people hospitalized, new hospitalizations across the United States. The projections for the end of winter is up to 400,000 people. That is now those are based on mathematical modeling. They may be higher or they may be lower, but generally they within the ballpark of about 400,000 by the end of winter.
Mm. Okay.
And so
Now,
right
now,
now we're at 250,000, 252,000 people.
wow.
Yeah.
The NNPA reported that there are other effects aside from the respiratory part of from the COVID. Yes, the mental health issue. Can you talk about that?
I'm sorry, can you repeat that?
Okay,
I
there was an
didn't hear the
article.
last part.
There was an article done by the NNPA, which spoke to the mental health issues of COVID.
Right.
Hmm. So, can you speak to that?
Well, obviously, mental health is one of the most important aspect of any disease process, really. But in particular, with coronavirus, it is unfortunately one of the unspoken part of this illness. We're dealing with not simply the physiological processes of the illness, meaning you get sick, you're not feeling well at home, and then you might have to go into the hospital. You might be on ventilation or using a ventilator. You might be intubated, and if you survive, some people have physical symptoms that are longer lasting, which is also a problem and something that we're going to be dealing with a lot more in the next year. However, what we're not speaking about is the mental health aspect, and a lot of that comes from depression. People are depressed. People are worried. Obviously, people have been losing their jobs. People are not working under the lockdown situation. There are many people who are not working, and so they're not being able. They're not meeting their daily needs. Their financial needs, rent, for example, food on the table. We know that the food lines are a lot longer now. We know that people are being evicted. The moratorium in Florida, I believe, has been lifted by the governor. So there are more evictions. Obviously, people become depressed. It's a very difficult situation. They're at home. They're trying to juggle childcare, for example, with some people are working from home, some are not working, but they're juggling childcare, possibly having the coronavirus, not working, worrying about maintaining themselves, their family. It is a very difficult situation for many people. We have also seen the incidence of domestic violence increase in many
Mhm.
households. Child abuse has increased as well. And so people have been turning to, unfortunately, a lot of people are drinking more and doing a lot more drugs. A conversation that I've had with the medical examiner for Broward, he mentioned that the incidence of death or the prevalence of death from overdose and obviously homicide as well has skyrocketed since the advent of coronavirus. This is how some people are dealing with the situation. And so we are in a mental health crisis, and that is something that we will have to also manage along with the physiological aspect of coronavirus. We have to manage the mental health illness that comes with such a terrible physiological process. It isn't simply you get coronavirus, you become ill, you may survive. Most people survive, but there are the other conditions that people have to deal with, and it is very difficult for a lot of people.
Okay. There's a question that comes from somebody that can't get through from a Florence shelter, and she says, "I'm gonna, would I ask if it's safe to get a medical massage, even though they said the spa or whatever says it's been disinfected and the room has been prepped?
I'm sorry. Is it safe to get
A medical massage, Mhm. A
a medical
massage,
Like,
massage? What does that mean? I mean, I'm
I
not.
guess a chiropractor. I guess
yeah.
maybe.
Oh well, yes. If the chiropractor and the recipient of this procedure are both wearing a mask, it should be fine. As I mean, I'm assuming that the person is going to be using personal protective equipment while they are working on that individual.
Hmm.
And if the
Mhm.
person is wearing a mask and wearing the proper equipment, there should be no problem. It's the same as this, going to the dentist or someone else. If you are properly attired, if the practitioner is attired, then it should not be a problem.
Hmm. Okay.
Yeah. We have a question from Brian Stevens, who asks, "Why do other countries seem to have fewer cases and deaths than the U.S.?"
uh, Possibly, I mean, one of the, well, a lot of that has to do with reporting as well. Each country has their own system of how they report deaths, for example. So, in Germany, for example, if you have had COVID um, and you've had a heart problem as well, they are going to report that death as a heart, having you've died from a heart attack, for example, or congestive heart failure. And then the coronavirus will be considered a secondary or a tertiary diagnosis and therefore not considered coronavirus. So that might be part of it. The reporting might be part of it. As far as why we have many more cases, a lot of that has to do with our culture. Um, our culture. We're a very individualistic people, and we believe in our rights to exist and be free from certain things like wearing a mask or social distancing. And Americans as a whole are proud of their individualism, as well they probably should be, and they are less likely to be happy. Not everybody in America, but they're less likely to be happy to be told what to do. And
Hmm.
that is, it's a
Yeah.
cultural issue as well as a reporting issue. And we can spend, I'm sure, hours talking about why we are at we're so much higher than similar countries in terms of the number of cases that are here in the United States. But a lot of that has to do with reporting, and for cases themselves. For death, it's a reporting issue, but for cases, it's a cultural issue and a political issue.
Yeah.
We can't really escape the fact that we are dealing with a political issue. And the idea that doing certain things is what one person does because they are of a certain political persuasion versus something else. That might not be as big a problem in other countries.
Okay.
Yeah. Yeah. Um, Now, I'll be very honest. I've had COVID. I had a very mild case uh, of it. But one of the things that I notice is that I do have what they call brain fog sometimes. Uh, can you explain that better? And is that a long term something I can expect long term, or is it something that may be a phase? It's not something that happens every day, but I do notice it. I'm very cognizant of it.
Yeah, the what we're calling the brain fog is one of the neurological conditions of COVID, and we're seeing it in what we're calling the long haulers, the people who have had COVID and 6 weeks, 8 weeks, 2 months, 3 months later, they're still having symptoms. Um, why some people have what they call the long haul conditions and why others don't is at this point in the pandemic and in our understanding a mystery. But a lot of that comes from the neurological processes that happen for some people who have COVID. And the neurologic COVID is one of those diseases that the thing that is somewhat frightening and somewhat surprising to scientists about COVID is it seems to attack so many of the body's systems. So it's not simply a respiratory disease. It is a renal disease. It attacks your liver. It can attack your heart, and it attacks your brain. Um, the fog comes from just the neurological processes that have gone awry because of the COVID. The reason why that has occurred is your body has had some mild neurological damage, and
Hmm.
most of the times it's not it's not permanent. Most people who have had what they call the brain fog have gotten over it, or they are getting over it in time. But it takes quite a long time. I mean, there are reports in the medical journal of people who struggle to remember how to do very, very simple tasks. People who, in the past, like radiologists, for example, people who are very, very detailed and meticulous, with brilliant memories, have forgotten how to do very, very basic tasks. And it is very, it's disheartening for these types of people because they're accustomed to being in full control of their faculties. You haven't lost your faculties, but it takes quite a while for your body to repair itself. And at this point, we're not seeing that it's not reversible. What we're seeing it is over time they improve and get back to normal, but it is taking time.
Mm.
Yeah. Yeah. Well,
Don't worry, you'll be okay.
I've been told I was crazy for a long time. So my mom kept saying, "Quit acting like you ain't got no sense." So I'm okay.
Yeah, it is one of those conditions that is a bit of a worry to most people. Why they have not, why they've forgotten things, or why they're not as sharp as they thought they were. They're mentally, they're wondering why it takes so long to remember how to do some very simple tasks. But it's just one of the,
Yeah.
let's just say, the lingering conditions of COVID.
Yeah.
Hmm.
Yeah. I've found myself stopping in the middle of a task, just completely
Yes, and
freezing,
that's part of it. Your brain
and then
is,
yeah.
it's repairing itself, and the best you can do is continue to do the things that you do and stay healthy, and that has been shown to be the number one way that people get back to
Mm,
normal, just by
yeah.
maintaining your routine, healthy routines, and obviously you want to follow up with your doctor as well if there's anything that goes
Hmm.
awry.
Hmm.
Yeah.
Oh no,
And we
there
okay.
was a
Go ahead,
question
brother.
that came across the screen. You answered it earlier, um, but
But
there
I'm
was a,
happy to answer again.
can you hear? Yeah, it was which test was the best? He said, "Good evening. My question is, what is the most accurate testing method? I've seen three different methods: swabbing, one nostril, both nostrils, and the throat swab."
Yeah, right. I'm not sure which one is the most sensitive, but as I had mentioned earlier, the ones that they, the further up your nostrils they go, the better the culture. So it's simply a matter of gathering the best sample that has the most possibility of having the viral culture. That way, they
Mhm.
when they run the PCR, they can find more of it. The cheek swab is probably the least sensitive. The finger sticks is it's not even approved by the FDA. The cheek swabbing is approved, but it's not as sensitive. The nasal swabs are pretty sensitive, and probably the oral, the throat swabbing as well.
Okay. And can we get COVID from eating different kinds of meat? Can that virus thrive on food?
It has not been shown to be transmitted from eating.
Mhm.
Obviously, when you do eat, it's the food is, unless you're eating raw food, which sometimes we do if we eat sushi or certain types of beef preparation. However, if it's cooked, it's unlikely that it's not. We have not. That's not been shown in the literature yet that it is transmitted through consumption of food items.
Mhm.
Yeah.
Mhm.
Yeah. Yeah.
Mhm.
Now I now was this, and I guess it was. Don't want to call it fake news, but early on, I do remember an incident where they said a tiger or a feline animal at the zoo contracted COVID, and the only person the animal had been in contact with was a
The
human, and so
staff. Yeah.
yeah, so are we continuing to see that maybe this virus is mutating uh, and we're still catching up, or where are we in that fight?
Um, the I think it was the I don't know I'm not sure if it was the Bronx Zoo, but anyway, the animals, the tigers and the lions, were they did the test and they were in fact positive for coronavirus. The animals had shown symptoms of illness as well. They had developed a dry cough. um,
Yeah.
and
Okay.
they were fatigued as well. So the animals were somewhat listless a few days,
Tired
and
of
they had a
chasing
dry
these
cough.
monkeys today.
They had a dry cough as well. It was assumed that one of the staff who had been caring for the animals passed the coronavirus on to the animals. The animals recovered. Um, those animals, as far as we know, had not then themselves passed the corona on to others. However, within the last week, 17 million minks were euthanized in, believe it's the Netherlands. Minks
Wow.
are the animals. If you don't know, they are the little cute little rodents that we use to make mink coats. I don't wear mink coats because I don't like the idea of killing
Right.
animals to make, you know. I do wear leather shoes, so that's another thing altogether. But um, minks, the minks had developed COVID. Now, these are the only animals that we know of thus far that then passed the illness back onto humans. So it was documented that they became ill. A number of the minks became ill from their human, the farmers who cared for them, and they then in turn passed the coronavirus on to their human handlers. The worry there was that they found a few of the animals had mutated versions of the coronavirus.
Mm.
So there was a mutation in the coronavirus in the minks, which is why they euthanized all of them, because they fear that if the minks passed on a mutated version of the coronavirus to the farmers in the Netherlands, who will then pass it on to the rest of the community, any vaccine that we develop will not work. It will not work in the Netherlands, and very soon it will not work anywhere else because obviously we're not static. People travel. And so, in that case, we have, as far as I know, they have removed the minks, 17 million minks from
Wow.
the Netherlands.
Yeah.
We do not know at this point of any other animal group that has passed the coronavirus back to humans. Minks were the only one. The tigers and the lions at the zoo did not. And dogs and cats have been shown to have coronavirus as well, but they have not been shown to pass it on to their human handlers or family members. But the
Yeah.
minks have, and so that's why they were
Yeah.
euthanized.
Yeah. I was watching a documentary recently about uh, this thing called bushmeat, uh, about hunting wild animals in the African bush. And one of the animals that they put at the top of that list is a civet, which is a type of cat and is a
Yes.
delicacy in China. And so they're looking at possibly just even in the transfer of
Right, and
that
civet
meat
was
from
the
one country could be another.
right. Civet was the original animal that was blamed for being the intermediary. So, in the meat market in the Hunan province of China, Wuhan, is it Hunan? I think it's Hubei or Hunan. I'm not sure which province now. But anyway, the Wuhan market, meat market, they assumed that civet was the intermediary animal. So, obviously, the handlers, the sellers of the meat working with the civet, which is a delicacy, then were passed it on. It was passed on from the civet to the human host, and then throughout the community in the area, and then throughout China, and then the rest of the world. We do not know that that's the case. They also blame the bats as well.
Yeah,
Yeah.
And we may never know. The point is, we have it here now. So whether it's a civet or the bat or something else, we have coronavirus, and it's
yeah,
something that we're gonna have to deal with.
Right. Right.
yeah. We do have it here. Breaking news: 170,000 new cases, 1,899 deaths. So it is here.
Right.
Today.
We are at the point now where if you get anything under 100,000, we are thinking, wow, that was not a lot at all. Yeah, we are at that point, and partly is students going back to college and coming back. We had started to relax our standards, obviously reopening our communities, businesses, people going back to bars, people going back to restaurants, people going back to their daily lives, the things that they like to do, spending time with their friends and their families, loved ones. sitting at a bar, sitting inside of the restaurant, doing the things that make them feel happy as human beings. And these things have a risk with them. You can still do the things you like, but you have to be able to perhaps manage to avoid certain riskier behavior. I love it going out to restaurants as well, going out with friends. However, I've avoided doing a lot of those things because I know it is riskier.
Yeah.
And so that is why we're seeing now. We knew that in the winter time or coming winter, we would have more cases. That was a given. And we are going to be struggling with these high incidents, meaning new cases, until probably March, April of next year, when we're in the dead of winter, when people are spending a lot more time at home and indoors. And also when we're dealing with flu. Flu is another respiratory illness, and it's important that everyone knows that you can get the flu and the coronavirus at the same time. And that is probably one of the worst things that could happen, because now you have a super infection of flu and the novel coronavirus, and one renders the other one a more severe illness, which is why it is recommended that most people who are vulnerable get the flu shot. It isn't necessarily my recommendation, but it is the recommendation. I myself will get the flu shot. Typically, I don't, but I think I will this year.
Okay, there's another question that came across, and the question is: are you optimistic about the new administration getting a better handle on this virus, making a positive difference in 2021? And this comes from Florence Shelton Clark.
I am positive. Well, I am optimistic that with the new administration, we will elevate the role of scientific practitioners. We will elevate the role of people who have been doing this for a very long time: epidemiologists, vaccinologists, immunologists, scientists of all stripes. We will elevate their role, and therefore they will have a bigger, let's just say, audience. I'm confident that we will do that. I am also aware that with as many cases as we have, and will continue to have, it will be very difficult to manage this. And with the problem of um, people not necessarily believing that this is something that is serious, it's a hype, and in
Mm-hmm.
some cases people think it's a straight up hoax. We will be dealing with that. So it would be naive of any of us to think that within the next few months, come this January 21 and beyond, it's suddenly going to get better. It will not get better. However, once we start elevating the role of scientists and community practitioners, not simply scientists, but the people in the communities of all stripes who care about these type of things, we will start to get a better handle on the disease itself and on the pandemic. The advent of a vaccine should also be helpful if it is effective in the long run. They're saying now the vaccine is 90 to 95, depending on which company. Pfizer is now 95, Moderna is 94.5. AstraZeneca came out with theirs today. I'm not sure what their effectiveness is. However, um, it's a great start. It's a positive start. However, we need a lot more time and information to see if the vaccine themselves confer immunity for the long haul. Typically, with respiratory viral type illnesses, vaccines tend to last a year. Flu vaccines are notoriously iffy, meaning if you get 60 to 70% effectiveness in a year for the flu vaccine, you've done quite well. Typically, it's around 60%. Sometimes it's as low as 40%. I think 2 years ago we had a pretty bad batch in 2018
Hmm.
of
Mm-hmm.
the flu. It was not very effective at all, and that's because the virus mutates. And so what they
Right.
designed today might not work a few months from now. With the coronavirus vaccine, the technology is pretty. It's astounding, really, and if it mutates, they have now the ability to quickly change the formula, the recipe, and make a new one very quickly.
Okay.
So that is an if this technology works, we're in for a breakthrough in a lot of different diseases, not simply coronavirus, not simply the flu, but a lot of different diseases.
Okay.
Yeah.
Okay. There's a question that comes from Curtis Wells, and he says, um, "Is it true about the different blood types that certain blood types are less likely to get COVID?"
I have read that. Unfortunately, I don't know right now which blood type supposedly was the one that was most protective. But I have read that I think it's the science on that is mixed. It's not. They're not sure. I think I will after we complete this. I will do some more research on that, and I can have a better
Yeah.
answer for you. But as far as I remember, there has been some studies looking at blood types, but I think it was inconclusive at the time. Now that was a few months ago, so I'm not sure if anything new has come up. But I will definitely look into that one.
Right. Yeah. And related to that, we have Pamela Young who said, "Can COVID be tested through blood being drawn?" Or I guess maybe that's the blood plasma. I guess I'm not sure.
Yes, it can be, but I don't think that is the primary route that they're doing. It's easier and less invasive to simply have a swab. But yes, if someone prefers to have the blood test, it can be done. They're simply looking for the viral particle, and it can be done through a blood test as well.
Okay. I see we got a question coming from the Washington, D.C. area. Ronald Bartholomew asks, "Is it a good idea to wear a face shield when shopping in crowded stores or if marching at a protest? Is this better than just having a mask?"
The face shield prevents viral particle from actually entering to your mouth, your eyes. The virus cannot go through the actual shield itself, so it is not a bad idea to do. Um, the mask itself protects someone else from whatever. You can still breathe. While you're obviously you can breathe, and you yourself can pass on possibly the coronavirus if you're not wearing a mask. That's quite possible. The face shield protects only you. But yes, so it's not a bad idea. I would simply say that also wear a mask if you're going to wear a face shield. It's double protection, and it's certainly it's a good thing for the individual who wears it.
Okay. Okay.
Okay.
Okay. There's another question coming from Sabrina Beesonville. She asks, "How confident are you in the implementing of vaccines and will you take it?"
Uh, I am confident that with an administration that will elevate scientists and the processes that go around getting a vaccine into production, manufacturing vaccines, and distributing it, we will be able to get the vaccines out and about and ready for everyone. At this time, any vaccine, AstraZeneca notwithstanding, but Moderna and Pfizer, the first two that came out with theirs, will be able to provide up to 40,000 doses. Moderna says they will do 40, and I think Pfizer can do 40. So 80 million in total. That that will vaccinate 40 million people because each requires two doses. Pfizer's require an initial dose and 3 weeks later the booster. And Moderna requires an initial dose and 4 weeks later the booster. So 80 million doses between the two companies will provide for 40 million individuals. At this time, they will prioritize frontline workers, or healthcare workers, and people who are at higher risk. Probably the elderly, people in nursing homes. For the general public, it is assumed that they will not have enough until around April, May. The Moderna vaccine requires fairly low temperature, but something that can be um, that they can do with a normal sub-zero refrigerator, which a lot of hospitals already have. Pfizer's is a little bit more difficult. They require very, very low temperature, so they're going to have um, a lot more. It's going to be a lot more difficult with Pfizer's vaccine because they require, I think it's a minus 94 degree Fahrenheit storage. It's a very, very fragile vaccine. And so it will be difficult, but they already say they have their own manufacturing processes and their own refrigeration that they will then distribute the vaccine. I'm confident that we will be able to develop the logistics. It will be difficult, but we'll be able to develop the logistics to manage this. I think that we will be able to have it for the general public, according to what they're saying, by May. Will I take it? I will wait until the the vaccine, the information is out and it's in peer-reviewed journals. Right now, the companies themselves are providing the data. However, they need to have the peers, scientists, and everyone review at length and in great detail the efficacy and the safety studies. They need to be published in journals, and at that point, I will think about taking the vaccine. At this
Okay, Bart.
point, all of the information is coming simply from the pharmaceutical companies themselves.
Okay, Bart from DC. He asks another question. He says, "Since I'm physically fit and I work out and in good condition, if I get coronavirus, are there breathing exercises that I can take to improve my survival?"
It's generally the, if physically fit, that's wonderful. If he is in such a situation that he needs to be hospitalized, it's the physicians and the nurses and the respiratory therapist who will explain what kind of breathing treatments he needs. People, there have been studies that say just normal deep breathing is good because um, it draws oxygen in through the nostril, and apparently the coronavirus is not happy in that environment. And so it's never a bad idea to breathe deeply and breathe out. It's a nice exercise. It's also meditative and it's calming. So that's not a bad thing to do. However, should someone be in a hospital situation, breathing exercises is something that the respiratory therapists, pulmonologists will recommend, and it obviously has to be done in a way that makes your survival better. So it's not for me to recommend the type of breathing exercise that one should do if one should have coronavirus. That's the
Yeah,
respiratory therapist's job. However, any breathing exercise for any healthy individual is a good thing.
yeah. Now,
Mhm.
I do have a question.
Can you,
Early
may I
on,
take one minute? My phone is at 1%. I do need to
sure,
plug it in. Do you mind if I just run and get the cord?
sure,
Sure,
All
sure.
right,
okay,
Hmm.
thank you.
sure.
Okay. Hmm. Mr.
And
Busby.
everyone,
Yeah,
hey,
yeah, man.
yeah, no, and everyone, if you just have a question, please don't hesitate to type it into Facebook or to the YouTube, and we'll definitely ask it. I have enjoyed this. We've had some great questions
Hmm.
and really some wonderful answers. Uh, but man, 170,000 cases in one day, huh?
New cases.
New cases,
New cases.
man,
Over
and
18,000,
t- almost
1,800 deaths.
1,900 people dead.
This is serious, man.
Wow. This is real serious. Really,
Okay,
really.
okay. Yeah, we're gonna be wrapping this up here shortly, huh?
Yeah.
Yeah. But Perry, while we doing this, we were discussing, this is the end of the year coming up, and
Yeah.
um, we certainly enjoyed this. So
All right. Can you hear me?
no.
Yes, yes.
Okay, I'm back. Sorry about that.
Hmm. Your question, Perry?
Yeah. So early on, I had heard something about, um, especially with African Americans and the effect of being locked in and the lack of vitamin D deficiency. Uh, don't know all of the story, but again, was just asking because I there was some idea that the lack of vitamin D that African Americans usually get just by, I guess, their daily routines, that somehow became a impediment and them contracting COVID, or had you heard anything about that?
Yes, there are studies that suggest that vitamin D is protective against the coronavirus. That is to say that it helps to fight. If you do get coronavirus, it helps to make the disease a less severe disease. And so
Mm,
the recommendation is as much sun as possible, 2 to 3 hours per day on the leg, the back, face of sun is the recommendation for all the vitamin D you need. However, in the absence of sun, anything that's fortified with vitamin D, cereals, for example, breakfast cereals, dairy products, fatty fish, salmon, mackerel, that type of thing will have a lot of vitamin D. And so it is protective. How protective it is, we do not know yet. Oops, I'm so sorry about that.
Hmm.
mm-hmm.
Doesn't seem to
Hmm.
be
Okay.
charging either.
Hmm. That's
Right.
okay. At least that was your phone. I had something to fall on the back of my head, so that's okay. We all right. Mhm. Yeah. Mhm.
Yeah, we've had some moments.
That's
I don't.
strange. Vitamin
It
D
doesn't seem
that
to be
comes from the
charging.
sun, and you would think
Yeah,
that we, as children of the sun, would not have that problem. But hey, okay, we got another question here. Miss Sabrina Beeson Bill asked if a person have had coronavirus, do they have antibodies to prevent them from getting the virus again? That's the first part. And would one who has had the virus benefit or need the vaccine? Uh-oh, we
yeah. I
lost
don't
Miss
think
Mother.
her
We
phone
lost
was
our
charging.
epidemiologist. She was having
I
difficulty
think
with her phone.
with a phone.
Yeah.
Yeah,
Okay.
yeah. Well,
Okay.
I mean, we've been a little bit over an hour, and we always known for going over the hour. They always
Yeah.
have to put us out the party.
Yep. Yep. That is true. Well, this beckons us to come back for another segment.
It does. It does.
Maybe
Most
not this
definitely.
year, but
No, but you were touching on something, and that
yeah.
was just
Yeah.
being the end of the year. Um, and so since we're closing, and we right up on the heels of Thanksgiving, I definitely want to end this with a moment of Thanksgiving
Yeah.
uh, for this year. 2020 has been a tough year for me, uh, but I am truly thankful for the challenge um, of coming through it, and because that challenge has shown me true friendship, great fellowship, uh, and just some encouragement to know that we on the right path. And so I am truly thankful for having come through this year, and definitely having spent it with my good friend along the way. We have had some times this year, but I wouldn't trade it for anything in the world.
Yeah.
And just to have us come to this day, and this show, and hopefully we'll have another show before the year ends. But if we don't, I do want to end this year by saying thank you,
Mm-hmm. You know,
Bobby.
no.
Uh, thank you. Uh, uh, this has truly been great, and thank you, Ari. Most people don't get a chance to see Ari, but Ari helps this thing uh, work, and I don't ever want to miss an opportunity to let everyone know um, truly how thankful I am just to be a part of this.
Okay. Ari, come on the screen, Ariel. Come on out of the back room. Hmm. Thank you.
Mr. Henry, I didn't intend on speaking this evening, but thank you for calling me out. Great show, gentlemen. There's been a
We
lot of
get
information covered.
we're getting a lot of feedback, Ari.
Can you hear me?
Are you?
Mm-mm. No.
I can hear it fine.
Oh, you here? I
Yeah,
got to get another apparatus. This, this is supposed
yeah.
to be a
We got
top of the
we got
line
to get you
tablet.
some new tech for
Yeah,
the
man.
new
This thing.
year.
This is supposed to be an iPad. You know.
Uh huh.
Yeah. One of the
We don't want to go
last
back
year.
to my story. You don't want to go back to my story.
No. No.
Remember,
Okay.
iPad
Hey.
ended up being the.
Hey. Hey. All right.
Yes, sir.
Okay.
This has been a great discussion. So thank you so much for informing our community of some of the things that we need to pay attention to as it relates to COVID-19. And it looks like Miss Mullings is back with us, so I'm going to bring her on screen shortly.
Mm-hmm.
And we thank all of our viewers for tuning in and asking questions. This is supposed to be a safe space for us to really understand what's going on.
Mm-hmm. Okay. I'm looking at a text message I got, and it says from Miss Florence Shelton Clark. Again, thank you for a most rewarding experience. Hopefully, it will continue in the new year. So that's some encouragement right there. Miss Mullins,
Yes, I'm back. My sincerest
that's
apologies. It just went
no,
dead.
no. Hey, this is
No.
this is what we pride ourselves on, is that there's no pretense to this. You know,
Hmm.
we believe in giving all we got, and then in doing that, things happen. So we understand that, but we were closing out, and we wanted to give you an opportunity to give us a point of hope in this pandemic. From your professional point of view, your extreme, profound, uh, deep studies in the that word epidemiologist. That what you do. So give us some encouragement, would you please, Miss Mullins?
Yes, there have been encouraging news, not simply the advent of now three vaccines. Today, AstraZeneca reported that there's already and then will be available within the next few weeks and is a lot more stable than the other two, meaning it can be stored at room temperature. But we're also, as the pandemic advances or as we know more, we're developing better treatment options. And so in the very early and ugly days of the pandemic, we lost a lot more people because we simply didn't know what we were doing. I think the phrase that a lot of doctors and healthcare professionals use is they were flying blind.
Hmm. Okay, I see she. Okay,
We may have
yeah.
lost Miss Mullins again, and we'll see. But I do want to remind our audience that you can check out the coronavirus report from Miss Mullins in our hard copy on page 5, and that's updated every week from
Hello?
her. There you are. Welcome back.
I can hear you. I could hear everything.
Okay.
Okay, we
Yes.
see you and
Okay.
we hear you now.
Right.
Mhm.
Yeah, I was saying that in the very early days of the pandemic, we did not know how to manage the care. I think the doctors and the healthcare professionals are doing a lot. They've learned a lot more, and so those are good things. We've developed some new treatment modalities, and that's
Mm-hmm.
good. We have developed some new second use for many of the simple drugs that we had. Remdesivir, as I'm sure you know of, we have monoclonal antibodies. We're also using dexamethasone, which is a corticosteroid. And so those are good things that we have. Now with the advent of the vaccine, we have another weapon in the armory. And that one is going to be a very big one. And so we have the potential effective vaccines that are coming along, new treatment modalities, and just obviously we need to also have the very important mitigation efforts that we need to continue: masks, social distancing, and we need to
Mm-hmm.
do all of those. And so with those things, disease mitigation, treatment modalities, and a vaccine, I do think that we are on the horizon of getting back to some bit of normality by the spring, early summer of 2021. We need to manage the next few months, and they are going to be difficult months because we're in the advent, coming up to winter. A lot of indoor activities happen again, obviously with the flu as another prevailing illness during this season. We will be struggling. We have had many, many cases, and so some of those will
Mm-hmm.
unfortunately not, they will not survive. And so we will have to be dealing with deaths, unfortunately, but we are on the horizon of many, many more options next year. And that's a great thing. And I am very confident that we will begin to see the light and the end of this pandemic within the next year. No doubt about that.
Hmm. Absolutely. Okay. Um, with that being said, I really want to thank everybody for being a part of this. And Perry, we're going to have to come back and really have a closeout. So, but
Mm-hmm.
I just want to say to everybody a happy Thanksgiving. And I know from our perspective, and I'm speaking from a black perspective, a human black perspective, we have always been uh, a group of people that believe in coming together. So it's extremely difficult for us, both physically, psychologically, and spiritually, for us not to be able to come together, especially at this time. So, understanding the need for us to be separate because of a pandemic, let us not separate our love for each other. Let us continue to be that same body of people that believes in giving, no matter what's the situation or what is preventing us from having a physical contact. There is something much greater than a physical contact, and that is a spiritual awareness of who we are. So I want to say, in spite of this pandemic, in spite of us not being able to congregate on a larger scale, the spirit is alive and kicking. Bless his holy name. And it says in Psalms 103 that he will forgive all our transgressions and he will cure all our diseases. So we will lean on that until we're able to come together again. We're still in the 2 minute warning, and it's a part of the game. So let's not forget. Happy Thanksgiving. I love all of y'all, and there ain't nothing you can do about it. Thank you.
Thank you,
Thank
and
you.
thank you
Good
for the
night.
opportunity. Happy Thanksgiving, everyone, and stay safe.
Absolutely.
Yes, thank you for
Happy
your
Thanksgiving.
time. Happy Thanksgiving.
My pleasure.
All right.
Thank you,
Bye
Marsha.
bye.
Good night, everyone.
Good
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 night.
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 Mhm.